Welcome and thank you for joining us today for Carepartners Passage Through Dementia. This topic has begun to touch many of our clients, friends, and colleagues on a very personal level. And so we're very honored to have with us today Paula Duran PhD, Director of Universal Dementia Caregivers, who's going to share with us today both her professional and personal knowledge of this very important topic. We have a lot of valuable information to share with you today, so we're going to get started. But before that, I'm going to share with you just a couple of housekeeping items. Just a reminder that we're unable to take questions during the webinar, but please forward to us any questions that you might have, and we'll make sure that we get Paula your questions, and we will get answers to you. At the end of this webinar, we will be providing to you some information on an upcoming Caregiver workshop that Paula is going to be doing for us at the Bloomfield Township Library in May, and that will be a very important event as a follow-up to this webinar. And with that, I'm going to hand the microphone over to Paula, and she's going to share with you some very important information. Thank you.
Thank you very much. Good morning, everyone. I am very pleased to be here with you today talking about a caregiver's passage through dementia. We will look forward to your questions that you'll provide for us at the end. This is a very personal conversation for me, in addition to a professional one. I'm a psychologist by training, and I really thought I understood dementia, but I really didn't understand dementia until both of my parents developed dementia-related diseases. Mom had Alzheimer's and Dad had vascular dementia. And in that, I learned from my heart the task of a caregiver that's required. So please know that all the pictures that you see are very personal for me. That's Mom and Dad you just happen to be looking at right now. They died 9 months apart after being married for over 60 years. So it was quite a challenge for us to take care of them because we made a commitment that they would stay in the home. Each family has to make that decision themselves, how they will be cared for. We just decided that they would be cared for at home. So let's get started with some general kinds of things. Let me tell you a little bit about who we are. We are a nonprofit, and we're focused on educating caregivers and their families, as well as communities, about Alzheimer's and other dementia-related diseases. Because caregiving is not something most of us went to school for. Most of us have other professions that we have engaged in, and then the need presents itself. And once the need presents itself, you have to figure out how we will manage this. It might be your spouse, it might be a parent, it might be a child. Caregiving is probably the hardest work you'll ever love. And please let me tell you, it's the love part of it that makes it work best. So let me just do some true or false. So you answer these questions to yourself, and then I'll also give you the answers in the process. Older Americans are the fastest growing population. And if you answer true, that's correct. We are. We are growing faster than most segments. The baby boomers are turning 65 plus, and the healthcare needs are becoming greater. More than 5 million people are living with Alzheimer's. Yes, true. And Alzheimer's is only one type of dementia-related diseases. Imagine if we tracked all of the different types of dementias, what that number could look like. Next, women tend to be the primary caregivers. Again, that's a yes. But we were talking earlier this morning, there's a trend that we're starting to see that the numbers of men that are taking on this role, it's starting to escalate. So it's important that we know women are the primary caregivers, but men are starting to develop more in this arena. The next item is Alzheimer's and dementia are the same thing. And the answer to that is false. Alzheimer's is a type of dementia-related disease, and I will explain in more detail as we go through the presentation. But dementia is a set of symptoms that are fairly common, and those symptoms are such that they get in the way of effectively managing your life on a daily basis. And I'll detail that more. And Alzheimer's is a specific type of dementia disease. The next item, there is a proven cure for dementia. I would like to say that's true, but it's not. At this point, there's lots of research, and I'm a believer if they keep seeking for information, they're going to find it. There's no real cure yet, and it's important that we know that at this point, at this moment in our time, depending on where the person is, someone develops dementia-related diseases, they're probably going to transition somewhere in the future. But again, we're all going to transition it somewhere in the future. So we just need to learn how to manage and have that journey, as I say, be a successful one. 1 in 9 seniors has Alzheimer's, but half don't know it. That's true, because the diseases start developing years before symptoms are ever seen. So the issue becomes, I may have it and don't know it, and then there's a group of people who have it, know it, but are in the denial phase of that process. And we can talk about that at any time you like, because it's important to know this. As a person with the dementia, you know when you have it. Typically, you have a good sense that the symptoms are starting to show, becoming a little more forgetful than normal, but we have learned how to work around it. Next item, medications are available to slow the progression of dementia. The answer to that is yes. But if anyone says they have a pill to give you that will cure dementia, I would probably run and go the opposite direction. Because as of now, I hope they find one, but they don't have a cure at this point. And the last one is the one that is so important. Caregivers are often referred to as the invisible second patient. That's absolutely correct, because our caregivers are so focused on caring for the loved one in their life that they themselves are not taking care of themselves. So let's take a minute and let's talk about dementia. Dementia is a general term of decline in mental ability, and it's severe enough to interfere with day-to-day living. So it's not a disease necessarily, but the symptoms of dementia. And it's important to note that dementia is not part of normal aging. So people will say, oh, they're just getting old and they're developing that dementia. No, dementia is not a natural part of aging, and it's identified as an umbrella term to identify a group of symptoms. So let's think about it this way. It's believed right now that there are at least 50 different types of dementia. I know. You've heard of Alzheimer's, you've heard of Parkinson's, you've heard of vascular, but you didn't know there were that many. There might be more, but as they keep researching that, they'll better understand. So some of the major types, which you have heard of, is Alzheimer's, vascular, Lewy body, and Parkinson's. And so the way I make this analogy is there's this file cabinet, and the file cabinet is called dementia. So all your files in there are related to dementia, but they're organized alphabetically. And in the first drawer is the Alzheimer's. In probably the bottom drawer is vascular. So you've got this file cabinet full of information on dementia, but there are different types of dementia in each of the drawers. And that's important to know. So thinking about what we know about dementia, Alzheimer's is probably the most common that we know of. 60 to 80% of the diseases out there are diagnosed as Alzheimer's. Vascular, maybe 10 to 20, Lewy body, 15, and then there's a whole nother other grouping, which makes up about 13%. Suffice it to say that when someone says they have Alzheimer's, it fits into the main category, and it's also the most researched right now. And one of the things, as we talked about, 1 in 9 seniors has Alzheimer's, half don't know. In some communities of color, the development of Alzheimer's is 2 to 3 times more likely. Higher rates in women, among women, and we said this before, women tend to be the caregivers. I just wanted to show you a picture of what a brain looks like with Alzheimer's. On the left side of the screen is a healthy brain. It looks vibrant. And on the right side is an advanced Alzheimer's brain. It's being destroyed from the inside. And it's important to know that some people in some communities seem to believe that dementia-related diseases are mental disorders. They're not mental disorders. It is a brain disease that we need to focus on. And it's changing the brain altogether. Also wanted to show you what the plaques and tangles look like in Alzheimer's. Look in the healthy area, the picture at the bottom of your screen. You see no kinds of plaques or buildup. But what's happening in a brain is that there's plaques that are growing around the neurons in the brain, and they disrupt the flow of information. So there might be, at some point, as I was telling my mom and dad both died from the disease, my mother forgot how to swallow. So what happened is that message that said swallow was no longer able to get from one side of that neuron to the other so that she could act. So that's important for you to see the buildup that's happening on the brain. And this next picture slide says that this is kind of the natural flow of Alzheimer's disease. There's some early some symptoms that present themselves. There's a diagnosis oftentimes, but I'd like you to know a lot of people don't go and have a diagnosis. I need to recommend and support you that if you're concerned, see a neurologist, see a specialist, find out if indeed you have the disease itself. Then as it progresses, there's a loss of functioning, the sense of independence that we normally have as a person. We start losing that. There might be some behavioral problems. And this really is challenging for those of us that are caregivers because some of the behaviors become real difficult for us to figure out how to manage. But even before that, it's that whole emotional piece of me looking and watching my loved one change and transition in front of me. Then the next natural progression is some people place their loved ones in nursing care centers or they choose to keep them at home. And ultimately, our loved one transitions. But I am a believer, and that's mom there for me, that if the researchers keep seeking out information, I believe there will be a cure. But it's important when you start seeing symptoms in someone that you not assume it's dementia. There are some things that look like dementia, but they're not dementia. And so I just wanted to put these in front of you because it's really important to start by eliminating some things first. Dehydration can cause a person to look like they have dementia. They become confused, they may slur their words, but the same for depression and vitamin deficiencies or head trauma. And amazing, a UTI can cause someone to look like they have dementia. So before you say the person has dementia, eliminate some of the obvious things and then go from there to someone to make a real assessment for you. So what's the cause of dementia? And if we could truly answer this question, I think that we would all be happy, wealthy, and wise. At this moment, we really don't know the cause. We know some things that have connections or some things that are interrelated, but we don't know the true cause. And in some communities, we're growing in knowledge and information, but some of the connections we've seen, and the list is on the screen, but vascular issues are very significant in terms of the connection to dementia-related diseases. Head trauma. Just think about it. If you had a brain injury of some kind, it could have disrupted the flow of the brain and caused some damage. Infections. Amazing. The concept of nutrition has an influence or connection to dementia. Recent traumas or stress. Alcohol and diabetes. Again, I just want you to know there's some things out there that have connections to dementia, but we don't know them as true causes. But what I want to say later is that if you look at this list, there's some things on this list you can control. And I am a believer that the things you can control, you need to keep within your control. So there's some early warning signs that we start paying attention to. And let me list a few of those. There might be some memory loss. Some of us start noticing the person is becoming more forgetful. Might be some difficulty remembering names or planning and organizing. And this one of misplacing everyday things of value. I want to give you a little story about my dad as he started developing the disease, vascular disease. One of the things, his morning routine, because I'm big on honoring the person and the patterns that they had, his morning routine is that he would get the mail. And getting the mail, he'd sort through the mail and make sure the bills were paid and dealt with it that way. As the disease progressed in him, he still had a need to get the mail. But the mail started disappearing. And we didn't know where the mail was. And so bills started coming to the house and they were saying something was going to be shut off. And we knew that the bills were paid. So it was one of those things, how are the bills not getting paid? Well, we found that Dad would get the mail in the morning. He'd get in his favorite chair. And he placed the mail on the side of his chair and no one saw it except him. So what we did is, because we knew his pattern was to get the mail, because you need to honor them as much as possible doing the things they normally do, we had all the bills sent to my house. He still was able to get the mail, but I then had the bills and I paid the bills. So paying attention to what they're doing, being a great detective is really important, and honoring them to be able to continue to do the things they do as long as they possibly can is really important. At this phase, it is really important that we say, start the conversation. Having a conversation about dementia is really tough, but you need to start thinking about guardianship, power of attorney, wills, living trust, as well as having a conversation with the person. How do they want to be treated at the end stages of life? Do they want to be placed on a machine? Do they want to stay at home? Knowing their needs is so important, because that way you're not left with the task of making decisions, and then you may or may not know what their desires were. So start the conversation as early as possible and just keep it going until knowing the disease, once diagnosed, is going to progress. In the moderate stages, there's some loss of recent events. So it's one of those things where they might say, ask you what time it is. And you say it's 9 o'clock. Less than a minute later, they ask you what time it is. And again, you say it's 9 o'clock. By the third time, you're about to pull your hair out like, my God, if you ask me that question again. But the issue is they don't realize they're asking you the question over and over again. Your challenge as a caregiver is to be at peace in your own spirit first, and then honor them by answering the question. Or learn the skill of distraction, because at this point, it's real easy to distract them off on other topics. So increased memory loss and confusion, difficulty carrying out familiar tasks. You might normally have the person put on their own clothes, and you know when you put your socks on, you put your pants on, you put your shoes on. They may put their shoes on first. And what we usually do is, Dad, you know you don't put your shoes on first. Well, they don't remember. And that feels like scolding. And you're not scolding. It's your natural reaction. But allow them to say, no, Dad, shoes not first. Let's put them on, the pants on first, and then we'll do this and this. So it gets back to how you manage you, which is really so important on how successful they will be moving forward. Sleep habits may change, and problems recognizing family and friends. To me, this one on the bottom is really interesting. There will come a point in this journey where they will not know your name. And this is so powerful, because a lot of people struggle with the loved one not knowing their name. And so it then becomes about you and not about them. Once I asked my dad if he knew my name, he looked at me and said, don't you know your name? And all I could do was laugh. It was that moment forward that I decided I knew my name, and if he never said it again, I was okay with it. Because what I didn't realize is I was causing stress in him, kind of saying, Dad, you know me? What's my name? What's my name? And it was all about me, forgetting about that he was the one with the disease. I always say it this somewhere in here, I'm the one that's supposed to have a healthy brain. So why am I behaving in this manner? So at the severe stages of this process, they won't be able to recognize themselves or others. Communication styles change. This is where I think it is so important that you learn how to communicate in a way that you're uncomfortable with. We're normally want to talk to people and they respond. I am a believer that they are trying to communicate to you every gesture they make towards you. You have to step back and learn what those gestures mean. There will be some assistance may be required on everything as they progress. This whole notion of fear and suspiciousness will start. You might even be accused of stealing their money. And you know your natural response when someone says, you stole my money. No, I didn't. No, I didn't. No, the wrong response, but it's a natural response. They become very fearful. But if you can step into their shoes for a moment, right now, I know where I am. And less than a second later, I don't have a clue. So that changing is very scary. And if you can really get in touch with that feels like, we would all be more caring and slower in how we responded to loved ones with dementia-related diseases. Well, that's my dad. And one of the frames that we have this bookmark that we available. It says, honor who they were, love who they are, and welcome who they will become. Because it's the same person who has now gone inside, and they themselves, we need to honor, love, and welcome them as they move forward. There's some foundational concepts I need you to think about. Everyone has the same basic human needs. People think that because a loved one has dementia, they don't have the same basic needs. They do. They just don't know how to tell you they have those same basic needs. And the little funny story, so smile with me, is that sometimes a loved one might do something inappropriate sexually, grab or touch someone. Well, we have all had these inhibitions. Our brain tells us there's some things you shouldn't do in public. Well, remember, their brain is losing those inhibitions. They're being destroyed. The needs are still there. but they may not be expressed the same way as you and I may express them because the inhibitions are disappearing. You are the one with the healthy brain, so it's really important that you are the thinker and the love and the support. Be a good detective. A good detective is someone who learns the gestures of the person and how they express themselves and how they might be asking for something. This next foundational concept, they may not remember your words. They remember your energy and your spirit. So if you approach them sad and angry, they don't remember the words you said. They remember the energy with which you approach them. This next concept is know that every behavior is an effort to communicate. That is so important. They want to communicate with you, but it will look different. So we created these concepts of care, and I won't spend a lot of time on these, to say, though, they're all focused on connecting with their heart and their spirit. Most people do a really good job of taking care of their bodies, but they seldom take care of their heart. Just to point out a couple, remember for me, when we train people on how to use music, because music has proven to be very helpful on reconnecting to the heart of the person. Comfort me with touch. We have a massage therapist that comes in and teaches techniques around how you touch them in little ways that bring satisfaction. And it's funny, on this one in particular, we have a journal that we ask people to complete. And in my mom's journal, under Comfort Me with Touch, and what happened is that people would come and visit her, and they didn't know what to say. Because it's like, well, does she understand me? Does she hear me? The hearing's not gone. The ability to process the information might be. So in her journal, it says, you can oil my scalp. So people would come in. I left a brush and some oil right next to her in her bed. And people would come in and they'd oil her scalp. And you could see the pleasure she was getting from this experience of being touched. Because sometimes with our seniors in particular, they're touch deprived. So it's an opportunity for us to stay connected to them in a physical way. So that's all I want to cover on that one. If people are more interested, I can cover it in more detail later. Now, are there some things you need to do at this point in your life if you're concerned about your own capacity, cognitive capacity? Here are some activities. Communicate with others. Don't isolate yourself. Don't isolate your loved one. Connect often. It is so important. The human connection is one of the most powerful things that you could ever do. Read, puzzles, garden, cook, anything that's touching you and your brain and causing your brain to reconnect is really important. Computer games, exercise, stay active, keep the brain stimulated. And if you have grandkids, they're a great way to stay connected. They will challenge you more than anything else. So just here's a list of some healthy things you can do to keep your brain engaged. Just sitting and watching TV is not a healthy activity for engaging the brain. Let me touch now just a bit on caregivers. Those of you that are caregivers, I know that is that's hard work. And it's not only hard, it's heart work too. And there's a lot of stress that presents itself in us. And we may or may not see it, but I want you to know if you're angry or have high levels of anxiety and you don't know what it's about, or you're kind of popping off and not sure why, or you're kind of crying in the corner and trying to hide it, feeling guilty, it's like nobody will help me and I've got all these siblings and they won't even help me, and you never seem to have enough time, you need to slow down and ask yourself, am I under stress and just trying to ignore it? Because I am a believer that an unhealthy caregiver provides unhealthy care. And I need you to take care of yourself, especially because you also need to care for the other person. If you've made that decision, you need to remain healthy. And so know your stress signs, whatever they are. Each of us knows when we're under stress. I just want you to pay attention to it. So some of the ways you can help manage the stress of caregiving, because nobody knows what a day is like. You can start early in the morning and you think you're going to have a bath by 8 and you're going to have breakfast by 8:30, lunch is at noon. Oh, and meanwhile, we're going to do this, this, and this. You have got to adjust your expectations about what the day will look like. There's some days all you can do is give them breakfast, keep them clean. You may not accomplish everything that you planned on doing, but the issue is you have to sometimes work with their schedule and not the schedule you're putting them on. Please allow others to help. And I was guilty on this one. I guess I thought nobody could do it the way I could do it. And I guess that's true. I believe that. But I was burnout. I was tired. And other people were trying to help, and I was in the way. So allow people to do what they can do. I had one family we were coaching said, well, my husband he won't do any of the care part of it. I said, then allow him to do what he's able to do. Can he pick up the medicine? Can he go and bring lunch home maybe once a week so you don't have to cook? Are there some things that he can do that honors the way he chooses to do this, but also helps you at the same time? It's important that you increase your healthy behaviors. If you stop exercising, please know you need to start back. And you'll say, well, I don't have time to exercise. Every time you walk down those steps to wash clothes, make that an activity of exercise. So just kind of lift your knees a little higher, move, just make everyday things, activities and exercise for you. I need you to have a positive mindset. I was thinking about some people who are caring for loved ones and they started this new year, 2018, and there's like, same old stuff, another day. This is a new year. It's a new opportunity. It's a new gift that you've been given, and you have to figure out, how do I live this year and not just exist? Because too many caregivers just exist in life and they no longer live. Okay. This last one here, I want to reiterate, they may not remember your words, but your tone makes a difference. If you're snapping off or you're snappy or sullen, it is really important to know that people feel your energy. It's much like kids. Kids really understand your moods. And it's important that you know that they feel your and sense you, even if you say nothing. One of the things that happened in my family, I made it a rule, if you weren't happy, you couldn't see mom and dad. So if you came in depressed, I would tell you, I wasn't well liked, so let me tell you that too, by my siblings. But I wanted to have the best energy I could possibly have around them because they were at a place they could no longer fight off the negativity. The other thing that's real important here, television carries a lot of awful messages. I had a nephew who wanted to watch TV with my dad, but he always wanted to watch Jerry Springer. I don't like Jerry Springer, period, but not so. That's just me. But my dad would get so anxious watching it. When the kid left, Daddy became very upset. So I had to stop them from watching Jerry Springer because it was so negative and that energy was getting into his spirit. So it's important to know what they're watching, providing soothing kinds of music, people who are caring and sensitive. I also serviced another family where one of the sons would come over depressed all the time and tell mom. So their pattern was he would tell mom the stories and mom would resolve things for him. I said, that kid, I love that kid. He can't come over here until he sees a therapist. Mom was taking on all of his negativity and depression, and she would just cry when he left. And they couldn't figure out why she was crying because she wasn't in pain. But it's important to know she was taking on that spirit that he had. And one last story on this one. We were invited into the hospital with a family, and the mom was in advanced stages of dementia. And the whole family was kind of sitting around talking, and all of a sudden tears started rolling down her face. And I had stepped out, and they called me back in and said, something's wrong, Mom. I had the physician's check. She wasn't in any additional pain, but she was crying. And I asked the question, what were you all talking about? And they openly admitted they were talking about dividing up the life's possessions. And I said, she heard you. Because she has dementia, she didn't lose her hearing. That got into her heart, and she started to cry. Be sensitive about what you expose them to, because they're still in there. They still have the same needs, but they just don't know how to express them anymore. So some summary thoughts about the things I've talked about. This is the toughest job you ever loved. And I have to tell you that you really have to love someone to support them in this manner. Don't argue or try to force them to remember. Remember, you're the healthy brain. You stay in touch with that. Routines are important, and reconnecting to old memories. So keep routines if you can. As much as a routine with flexibility would be the way I say it. Know that music and touch have the ability to heal. So playing the music that they loved as a younger person, and that reconnects to their heart and their spirit. One of the things I always talk about is if I could buy every person an iPod and put the music selection of their loved one on it, That way, at any point in time, we could just give them some peace by playing their music. Be sure that the people around them are emotionally healthy, and it's important that you take care of you. It's important, and I always throw this in, come to some sessions, let's talk about it, and openly discuss issues. Remember that their choices are limited, and they're losing their independence. And imagine what that would be like for you, and what that would feel like for you if someone else had to make all of your decisions. It then makes you more sensitive to the person. They also go inside. Sometimes they just get really quiet. You got to restore balance themselves. So they feel like they're moving away from you. Sometimes they are, just to have some peace themselves. Know that every behavior is an effort to communicate with you. And I like this last one. Every now and then you can help them find their song. And what a gift to give to someone who's transitioning from a disease, a terminal disease, that you can help them have a song as they transition. This is just some of our services and the things we do, some of the materials we have available, and that's the end of my presentation.
Thank you very much. We do have a couple minutes here before our time is up, and so I had just a couple of questions that I've written down over the course of the last weeks or months that I've collected from just experiences with clients.
Okay.
And one that comes up quite often is I have clients with maybe loved ones that are in early to moderate stages of various dementias, and there's a big worry about exposure to frauds and scams, particularly by phone or by computer, and caregivers that are wondering how do they handle that without feeling like they're being mother hen, preventing their loved one from doing the things that they normally would do by getting on the computer, by answering the phone, but by trying to protect them from being susceptible to danger.
And that's a huge issue because many of our seniors, not even seniors with dementia, are being taken advantage of on the phone, on their computers, and sometimes by people who even live with them. And it's so important that we pay attention to that. You have to be very sensitive to the fact that paying attention is probably the most important thing you could do as a start. And I think that if they like those little sweepstake things, know that they will continue to try and do that, but you have to monitor it more. At some point, you may have to put some, like those child restraint things they put on for children to use computers. You may have to do that. You may have to go in at some point and just cancel certain calls that they may have or accounts that they have. In time, as it advances and you see a real problem, having the conversation with them is important. They may or may not comprehend it, but you have to honor them enough by having the conversation. You may have to change some credit card numbers such that they keep a credit card because sometimes they just need to have a credit card in their hand, but it doesn't work. And over time, it won't matter. The fact is they have a credit card. And if they give that number, it won't account for anything. Just being on top of it is important. And as quickly as you can, when you find that that happens, get the information on that group and that company, report it, contact them, do whatever you can, that's one less group that you have to deal with. But the number one thing, though, is paying attention. So if all these packages start appearing at the house you didn't buy them, but someone's purchasing them, you need to send that stuff back and close those accounts. Would be the starting point for conversation.
Another question that I have, because I see it happen quite often, is people that are care partners or caregivers that just think they have to do everything themselves, whether they have no family members around, maybe children that have moved away and just maybe no siblings or people that just aren't willing to help. Where do you suggest number one, they reach out if they need help, or what do you suggest to people who feel like they can't reach out for help?
Well, the starting point is understanding that none of us exist alone. Even though sometimes we try to behave as if we exist alone, none of us exist alone. There are resources in our communities. There are area of agency offices. There are social service offices in the community. If you were to just pick up the phone and say, how do I contact someone about senior care? You'd have a list of people available to you. But you start by saying that you don't exist alone. There are great resources available. It doesn't make you less of a person to ask for help. Matter of fact, it makes you more of a person, because then you're recognizing I have a need. And that could also lead to a social network. And if you're there by yourself, that's one of the worst things you could do, is be isolated by yourself. But then you may be connected to a church. You might be connected to a community center. There are various things in the community that are targeted at people in need. And it's not just seniors, but people in need. And I think it's so important. Tell somebody. And it could be the nosy neighbor if you want to, just to start out, because they may know some resources. People want to help. They really do. And there are services available. But you've got to get over this notion that I have to take care of myself, or I have to hide this. Would you hide cancer? You wouldn't hide heart disease. Why are you one want to hide dementia? It's a brain disease. So as far as I'm concerned, it's like a cancer of your brain, and it's eating your brain up. So one of the things that's important is that we connect with as many people as possible. And that's so important.
Absolutely. Where do you have any preferred, obviously your organization is one that's a great resource. Do you have any others that you would recommend as go-to kind of resources in our kind of Metro Detroit area?
And I was going to say, it depends on your community. I think the area agency offices are wonderful. And I think Oakland County has one, Detroit has one, Macomb. These are full service kinds of places that can provide you with direction, if not services. But also, and this one's income based, I really like PACE. PACE provides around the clock, they provide wraparound services, but it's primarily for low income folks. But it's got great services and day programs that you can support. And so I would start with the area of agencies, but then the Alzheimer's Association is available to offer support and assistance, and they have online care connections that you can talk to. They provide training sessions. So there's a range of services available. And that's kind of your area too. Are there some other ones you can think of?
Alzheimer's Association,
right.
I actually worked on their caregiver hotline.
Okay,
so
that's right.
And they will offer up other resources in the community. So I think that's a good go-to if you just have no idea where to start.
Right.
Even general information about even what type of dementia your loved one might have if
right.
you don't even know, or doctors to go to if you think you're thinking something might be going on.
Right.
That's a good number to call.
The other thing that you triggered for me is our hospitals. Many of our hospitals have units dedicated to folks with dementia-related diseases. You could always call, like if you were in the DMC, Rosa Park. Yeah. That's where I took my mom. It's a great center. So those kinds of places are in most hospitals, and so you could always call them as a resource to something else.
Right. Absolutely. There's resources everywhere.
Right.
There's not a lack of information. There's just, I think, a lack of sometimes desire, or not desire, but people are afraid.
Yeah.
To maybe they're in denial or afraid to start the process.
Right. And the important that's true. One of the things that's key is that we talked about a stat that a number of people have the disease and don't know it. Some of them have it and know it. And at some point, it's going to be so obvious to everyone else that I say, there's no shame in my game. Let me start early enough so I can, because if you start early enough, you can get not medicines that will stop the disease, but you can slow the disease. Who knows, if you slow the disease long enough, all these researchers out here that are working like crazy to find a cure, I want it to happen in my lifetime, because I am a good candidate for dementia-related diseases. Both of my parents had disease. So I am pulling for them that they come through with something fairly soon. So it's important that you know the earlier and the more you learn, the smarter you can become about the disease. Because some people don't know what to expect. It's in stages. You can know when the symptoms are happening, and you can say, okay, this is what they told me would happen. These are some things I can do right now. This is what they said happens here. This is some stuff I better go do at this point, or I should find myself doing at this point. So I think that the more educated you can become, the more willing you are to have the conversation and accept that this is not anything to be ashamed of, but it's just the next step in life. And I said, you planning everything else, why not plan this process too?
Absolutely. Well, we're kind of running up on time, but what I wanted to do was, first of all, thank everyone for attending. Again, be sure to send any questions to us. We'll make sure that we get responses to you or resources to you. And also to give a little preview that please watch for invitations for our May event. Dr. Duran will be facilitating a caregiver support event. It's going to be called Caregiver Support Your Health Matters. It's going to be a workshop oriented event. And we're going to be doing that at the Bloomfield Township Library on Wednesday, May 16th at 10 a.m. So please plan to attend that event and tell anyone you know who might benefit from that kind of workshop. Again, thank you for attending, and we will see you again next time.